So there are many treatments for PTSD, including prolonged exposure and cognitive processing therapy. But more recently, there's a lot of work that's been trying to understand how newer and more Eastern-influenced treatments can be helpful. One of these is compassion cultivation training. Compassion cultivation training was developed in collaboration with Stanford University. And the aim of this treatment is improving compassion, empathy, and kindness for yourself, others, and humanity more broadly. The course includes lectures, discussion in class, listening and communication, daily meditation, visualization, and breathing practices. The treatment that we use takes about 9 weeks with 1 session per week. And here I've laid out the different components of each of the sessions. Just like feedback. Sessions include things such as settling and focusing the mind, loving kindness and compassion, compassion for oneself, loving kindness for oneself, cultivation of compassion for others, active compassion practice, as well as really practicing integrating this daily compassion practice into your life. Here's an example of some of the material that's used within the treatment. This is for compassion for oneself. I'm going to read this just, again, to give you a really concrete idea of what we're trying to teach individuals that are in this compassion cultivation training. So think of a time when you experienced great difficulty and suffered a lot. Notice how you feel when you think of such an experience. How does your heart feel? Then, with feelings of tenderness, warmth, and caring toward yourself, silently repeat these phrases. May I be free from suffering. May I experience peace and joy. Then, with a firm recognition that aspiration for genuine happiness is an essential part of your being, silently repeat the following phrases. May I be happy. May I be free from suffering. May I find peace and joy. Similarly, when we also practice teaching individuals to be compassionate for others, we ask, as an example, with a relaxed but focused mind, picture someone for whom you feel great amount of love. Notice the feeling of tenderness and warmth this brings in your heart and how this makes you feel. Now think of a time when this person was going through a difficult time. Notice how you feel a sense of concern based on a feeling of tenderness towards your loved one. Notice how you feel his or her pain and have an urge to reach out and help. May you be happy. May you be free from suffering. May you find peace and joy. So this is an overview of the components of the compassion treatment that we've been looking at recently at the National Center for PTSD. I'm now going to turn and present some data on how it's been working so far. These are 2 small studies that we've completed. The first study, we had 20 participants, all of whom had post-traumatic stress disorder, and all of whom were engaged in a residential, inpatient treatment program for PTSD. While they were in treatment, we offered this compassion cultivation training. We let people choose if they wanted to be part of the group, and we collected data before they were in the group and after they were in the group. We were most interested in their symptoms of post-traumatic stress. So we used a self-report measure that asked questions about their symptoms, and we wanted to see how these symptoms changed between the time that they started the compassion training and afterwards. An example of some questions are, In the past month, how much have you been bothered by feeling very upset when something reminds you of your stressful experience? Another example is, during the past month, how often have you been avoiding memories, thoughts, or feelings related to this stressful experience? We're also interested in their hyperarousal, so asking them how often in the past month do they feel jumpy or easily startled. And we wanted to see how these symptoms were, again, before and after the compassion cultivation training. First, we looked at when they walked in the door. Before they started the compassion cultivation training, we asked them how compassionate they were. And we wanted to see the association between their compassion before they started the training and their post-traumatic stress symptoms. And what we found, just in these very basic associations, is that greater self-compassion and compassionate love for humanity were associated with lower levels of post-traumatic stress. This means that those people who had fewer post-traumatic stress symptoms were more likely to have self-compassion and compassionate love for others. We also know that these symptoms of post-traumatic stress, it was particularly those involving re-experiencing and arousal that were the lowest among people that reported higher levels of compassion. What I've put here is a graph of the data of the people that completed both time points of assessment, so that were able to fill out questions before the compassion treatment and after the compassion treatment. So on the left, you'll see before the compassion treatment, and on the right, after the compassion treatment. The white line are those people that did not go into the compassion group, and the orange line are those that did the compassion group. And you can see here that some people in the compassion group did much better after the treatment. But 2 people didn't change a whole lot, or maybe got a little bit worse after the compassion treatment. It's important to note that this study was self-selected. So people, if they wanted to be in the compassion group, they could be in the compassion group. And for those, we tried to get some data on people that didn't want to be in the compassion group. The second study, we're currently collecting data. This is a randomized controlled trial. So in this case, we have people that come in and we tell them you get compassion or you don't get compassion treatment. And we want to see how much the people in the compassion group do compared to the people not in the compassion group. So far, we have data on 11 people. They're about the same age as the first data that I presented, all men with post-traumatic stress. Unfortunately, so far we only have follow-up data on one person that didn't get the compassion treatment. That's the white line. All of the orange lines are people that received the compassion treatment. Again, on the left is before they started the compassion treatment, and on the right is after they finished the compassion treatment. As you can see here, some people did a little bit better after the compassion treatment. So the lower the number, the better and lower symptoms of post-traumatic stress that they had, the better they feel. And the higher numbers, the worse they feel. So here some people, some of those orange lines go down, which means that they feel better. But again, like before, there's some people that stayed the same or got a little bit worse after the compassion treatment. So overall, between these 2 pilot studies, we found that compassion cultivation training, and it's very small amounts of data at this point, 20 people or even less that had follow-up data on the first, and only 11 people on the second. Those that received compassion, only some of them got better. And people that did not receive the compassion treatment also got better. So right now we're trying to figure out why this might be. And we're still collecting data, so we can't really make any strong conclusions so far. But I wanted to give you an idea of the data that we've collected so far. It could be that we don't have enough, haven't followed people enough time after the treatment to see their effects. Right now we ask them right when they finish the compassion treatment, how is your post-traumatic stress? And it could be that we need to ask them months later when they have had time to really practice compassion. It could also be that certain parts of the compassion treatment are better than others, and that we should be just focusing on certain areas of compassion treatment and not all 9 sessions. It could also be, from my conversations during the workshops last week, that we're giving these compassion treatments at the wrong time. Right now we give them about halfway through this 90-day, so 3-month residential post-traumatic stress treatment within the context of a lot of other things that they're receiving. So the question is, should we give this earlier? Should we give this later in treatment? Or as some of the monastics mentioned last week, maybe we should be giving this treatment before they go to the military at all, which I think is a very good point. It's also important to mention a few things that limit our ability to generalize these data beyond what I've showed you. So there are many limitations because of the sample that we measured. All of the people that I presented data on are men. We don't have any data so far on women and how they have experienced compassion treatment. Also, these are all people that were in the military, so we haven't looked at other types of trauma, of which there are many. We've also had very poor follow-up among people who did not receive the compassion group. So everybody that received compassion has wanted to come back and tell us about how they're feeling. But those people that were told not to go to the compassion treatment, many of them did not come back, and we've had a hard time collecting data from them about how they feel. So I'll finish with just saying that we're going to collect data on 60 people total. So I presented that second pilot only on 11. So over the next year or two, we'll be collecting data on the rest of people. Half of those, so 30 people, will receive compassion and 30 people won't. And we'll hope to see maybe stronger differences, and if not, try to figure out maybe how we can improve when we're delivering the treatment, or maybe the treatment itself.
So Marcel, a few years ago, I was approached by some doctors in the VA system because they wanted to figure out ways of bringing meditation and mental training to soldiers coming back from Iraq and Afghanistan. And they had hoped that meditation would be a sufficient treatment for post-traumatic stress disorder in and of itself. And it's because the treatments you mentioned, prolonged exposure and CPT, are effective but are very difficult to complete. It's a very strenuous treatment. They work really well. So the suggestion I gave them was that perhaps meditation training would prepare a soldier for the Western treatment. And I wonder if you have given any thought to sequencing these treatments. Perhaps the preparation that meditation offers would make an unhappy soldier more suitable for the Western treatment after they bring this practice into their life.
That's a great question. Thank you. I agree that I think it's the real question, or what we have to figure out, is the timing of assessments, or the timing of treatment delivery, sorry. And it could very well be that mindfulness and meditation practices would be useful in the beginning of treatment. Indeed, prolonged exposure and cognitive processing therapy, which I mentioned before, are very difficult and involve the recollection of and really detailed rehearsal of the traumatic experience that someone suffers from. And many people drop out from treatment. So I think it could very well be that timing or using treatment, meditation or contemplative treatments before they engage in these more stressful or harder experiences might actually help both with their symptoms and just their ability to stay through treatment.
A couple of your people in your study got worse as a result of the compassion training. Do you have any thoughts about why that was?
Yeah, it could be that it could just be an initial reaction to all of the skills and things that compassion training brings up for them. And again, because we're only measuring them right after they finish the treatment, we might just be getting this reaction because this is such a new practice for so many people. And that's why I think it's also very important to follow people over time, 1 month, 6 months, or whatever afterwards, to see how, if their symptoms maybe have returned and maybe they do better, as well as does their practice of compassion improve. And the data that I've showed were just the post-traumatic stress data, but we're also collecting data on compassion to see how compassionate people are before and after the treatment. Great question.
Tindiki chutop de ngarago thuna chebayana ti nyinga chinjida tindiki thon son solate khonge dunge kang cheba yang yang cheun zaman ku dunge yan nembe jene be nyinga charronge da thong dus tinde inza tanda gen khorang suna chebayana ti chutop de eni juchung thunge hajang kale khabo yore son so de jesan juchung thugu mezang ngede nyinga ji thon son tinde inza tati nyinga yulu ta shubayana da mom shuyandu de ne rachoyamdu tinde inza tusimdu tinde inza gengi ti tholam te any tan juatan tolan shimba jitseage tingaji tone tolan shimba jitseage ne tande gumba yo mares chikje nipate tanda youtube chig nala niji goya tere niji goya de genkashi niji tanda penetu masu sonso niji gomde rala niji goya jere de yorte ting ngala ina kesha sabu rawjire niji shenla shamba de niji pha gongwa ma de rala chi niji gomsena ta sabu raw chasu tinde inza ti ngedena yang 가서 따따 지르고 말해서 샴 단다 코강이 티야데 애니 신라 파 샴바도 니지 제 마시는 태주지레마도 라라 샴바도 니지 제 마시 태주 추는 말에 라니 베 런통 체다 랑 진진 체다 베 랑베 토탕 제 참아 유와 토네 니 태샤주지 강이 지레상도 돼 딘디 인잔 디 샴바도 니지디 파쇼라 파 고야다 파쇼라 팔로제 제외치나 나단다 펜도 용우리성 딘디 티콜라 애니 겐라 애니 군스카리오스 나가디 쇼이
I have 2 questions. First one is that in your presentation you talk about treatments for post-traumatic disorders patients, and in one of the treatments the patients has to remember about the traumatic incidents that they had experienced in the before. And from my point of view, I think that if you are experiencing those traumatic events again and again, so instead of healing from those kind of experiences, you may actually making it worse for them, and because of that, you may have not got a good result with this kind of training. And so, what you have to say about this one? And the second question is that when you talk about the compassion and you talk about compassion towards the self-compassion, and this is the first time I'm hearing about this kind of compassion. Normally in our tradition, when we talk about compassion, compassion is directed towards other beings. And the reason why you are having all the problems related with lack of compassion is that you are giving too much importance for yourself and giving less importance for the others. So when you talk about self-compassion, actually it's the opposite, that the kind of compassion that we are talking about. And so what you have to say about this?
So the first, though it doesn't make a lot of sense at first thought, there's a difference between just thinking broadly about your traumatic experience, kind of like worry, and actually working through the traumatic experience and the details of the traumatic experience within treatment. It's not just a cursory look at what happened to you, factually based. Treatment for post-traumatic stress, the difficult treatment that involves rehearsing, is really focused on really understanding and working through the details and trying not to avoid a lot of the details and thoughts associated with the trauma. And though it might not make sense and it might not, at first, it seems counterintuitive, it actually has been shown many times again to be very helpful for people. But it's very different, I must stress, than just thinking about oh, this happened to me, or anything like that. It's really detail-oriented. In terms of the second question, I think it's a very good point that people, that this treatment that we use, as I said, focuses both on compassion for yourself and compassion for others. And it's very different, and we talked about this some last week, from the experiences of the Tibetan culture and the Tibetan practices of compassion. And this is an important point, and it's an empirical question. And it might be that we really need to focus the treatment only on compassion for others, and maybe that's really what would be important. And that we can only tell by first seeing if it works, and then seeing if there's certain parts of it that might be more helpful than other parts of the treatment. But it could very well be, and I think it's a good point. Thank you.
One follow-up to the first question. Western science, Western neuroscience has learned much about the way that memories reside in the brain. And many of us possess painful memories. And for the mind of someone suffering from PTSD, it's almost like getting up in the morning and not making your bed. You have a dirty room. And this practice, this exposure therapy that Marcel is describing, is an invitation to immerse yourself in this memory so that it can be reconsolidated and basically put to sleep. It never leaves you. There is no forgetting in the human brain. But the exposure therapy that Marcel describes is a way of tidying up the mind, tidying up the memories in the mind so that they are no longer troubling you. It is a burden you carry when you've not made your bed in the morning. And that is the way of the mind of someone with PTSD.
She's for the Senate, Chita, the Ninja Nalena, Chita Chinango. Then that Shatan Nancy told the Belembaina, Nanchinana, Gomunda, Mamboyara. Or did Tony any Miss Can any Ninja Nalen told Tene, and she's for the Senate, Chita, the Nango, me in Dabadane, give it up cartonas, Toyanas, Tichiche. And Ranila Tanagana Sum because and a Chita Mambocinala, and Ranila may be Ninji Gongo Chisunda. What did a Ranila may be Ninji Teda and a Susu Chidi Shibatinilata Cheva Yores and Cheva Yana and anything Manda Cheva Kandich Showers in the church.
When we talk about meditations, they can have different types of meditation techniques. So why you chose compassion meditation to cure post-traumatic stress disorder? That is the first part of the question. And second part of the question is that when you talk about self-compassion, what it is different from self-importance or taking too much care of yourself?
We're looking, so for the first one, we chose to look at compassion because we thought that it might be helpful, particularly compassionate love for others. And a lot of the other meditation practices have not been focused on that. Though there are lots of Eastern-influenced treatments that are proliferating across the West right now, and many different forms of meditation and mindfulness practices. Compassion a little bit less so, and we thought that it needed some attention and focus. In terms of the second one, it's the compassionate love for yourself. It's a tricky one, and I can definitely see how it could be beneficial in some ways, but also could make things worse. It's definitely, it definitely turns your attention inward, but in a little bit of a different way than you described. It's really about, it's kind of accepting and loving yourself and kind of forgiving yourself, because a lot of people that have experienced, for example, the military traumas have done things that are pretty horrific because of just the nature of war. And so in this population, I think forgiving yourself is an important part of moving forward. And so we'll see if that translates into them feeling better or not. But great question.
I have the fortune of also having been involved in the thinking for the compassion cultivation training. And so when we were imagining this construct of self-compassion, part of its purpose is to intervene when people are paralyzed by fear. What we know biologically is that if you are afraid or anxious, you actually shut down the systems in your body and your brain that enable you to be a caregiver. You're not able to be compassionate towards other people if you are always very afraid for yourself. And so I think the idea with self-compassion is a way to reduce that personal fear that people might feel both in the veteran population but also in the regular lay person's population. And so reducing that fear opens up some space for compassion, for extending your loving kindness to other people, because you're not afraid of protecting yourself. So I think that's the idea of self-compassion. And once again, our main contemplative contributor, Jinpa, he thought of self-compassion as what he called moistening the heart, a way to open your heart so that you're not tight and closed by your own fear, but you can be available for other people and more open.
네, 정말에 모두 상대당하네. 나가서 좋아. 지금 주셔요. 근데 거기서 마음이 세네 치스네 법이 마음이 망보지다 때 강에 지는 데가 되는데 거기서 단달로 로주 침부터네 제게 돼서 돌래 펜도게 상로 자침부터네 계대야 등하로 김마주였어. 에는 알아고 저와도 가르스나네. 니제 생에데 저당 론니바 침부지 차되고 그랬어. 론니바 침부데 밖에 당사대 강사 대안이 대단 렘바치 고고이제서 되고도스. 배나 맨니슈 침부제 무즈보 니슈 시라명에 직사와이나 안 콜레 펜네 체차니까 요리 대다 집안으로 된대고도스. 먼저 다 추선에 시와이나 니제 공화라 토마 아니 당용세야 지금 받은 것도 들어고야지 시에도 그랬어. 당원도 다 당용시에 돼야 돼. 다다는 그것도 탈랑지리 운중을 공대야지도 와. 운중을 공대야 돼. 말한 거 사실잖아. 마음이 내받아서라 뭘 니제 나래 제래요. 운중에 대편절할랬다나. 아니 편도치하면서 정도 이나야 다 그것도 신주 뭐 제사도서 뭐 니제 공야 당 운중을 공야니까 아니 마음에서 가득 편도 용치한 도서
So, first of all, I would like to appreciate the kind of work that you are doing for those soldiers who are having this post-traumatic stress disorder. And my caution is that when we talk about compassion, we believe that compassion is a very powerful mental state or a mental process. So in order for somebody to have the ability to practice compassion, one also needs to be a very strong person or strong individual. So I'm not sure whether it is kind of a good practice for the patients who are having these kind of problems. And I think that in our system we have this something called equanimity, and I think the kind of the attention towards breathing, that your breathing attention or attention to the breathing part of the program, I think is close to what we or it can be part of what we describe as the equanimity. And from my point of view, I think it would be better to have this kind of breathing exercise for these patients, and afterwards then you can try like something like compassion, and it would be beneficial, more beneficial.
Thank you. I think, yes, I think this again comes to the thought of timing, and it might very well be, and the components of the treatment, and when they're delivered, and which ones are most important. And I agree that it could very well be, I could see both sides. I could see that the compassion training, I could see it being best to wait for the compassion training until people have become stronger from other treatments, including meditation treatments. I could also see how how some of these practices could be used earlier on, maybe before they've experienced a lot of their post-traumatic stress symptoms. And we're working to try to figure out, again, both does it work and when we should deliver it. But I think those are great points. Thank you.